Hello, good afternoon and welcome. I'm Greg Allen, I'm the Chief Executive of Future Care Capital. And today you join us for an event on adult social care tech, the future of home monitoring. We're delighted to have you here with us, and a great panel has joined me today. I'll tell you a little bit about Future Care Capital first, very briefly. We're a 70-year-old national health and care charity, and we're all about raising the debate around the future of health and care and a fit-for-purpose system for the future. We work with policymakers, we deliver our own proprietary research in that respect, and influence and engage with them on that. We also work with practitioners on the ground, and we raise the debate with them around the future of the system. And crucially for this conversation today, in this event, we work with innovators and investors. And our strategy, linked to what we're talking about today, is all about data, tech, innovation, climate and sustainability, and investment in the health and care space. Now, today what we're going to do is take an in-depth look at the tech that enables monitoring solutions. And we're going to consider what the future holds for monitoring and how this can further improve lives and outcomes. This particular event is one in a series of 4 for this particular period of time. We held a previous event a couple of months ago. And following this one, we've also got another one lined up in July on mental health tech, and another in September on women in tech. For the structure today, after I've introduced the panel very shortly, we'll move into the debate and discussion. And there'll be plenty of time for questions as well. If you have a question, you'll be able to post that online. And I will endeavour to pose all the questions to the panel, and we'll do our best to get through those. But I can't promise we'll cover everything, but we will try. Now, with me today, I have 3 fantastic panellists. I've got Vic Rayner, who is the Chief Exec of the National Care Forum. Vic is a very high-profile leader in the sector. She's worked across housing, health, care and support, and has had various roles linked to government bodies and advisory groups as well. Amer Fasihi is the Chief Exec and co-founder of Cradle. He previously spent his career at GlaxoSmithKline and IBM, for example, and he founded Cradle in 2016. Cradle aims to address social isolation and support independence for users. And we have Mario Zuccaro with us as well. Mario is the chair of Oyster Technology, which he launched in the UK and Spain in 2008, after successfully creating and managing several businesses across Australia and Europe. And he was pivotal in the launch of Hawaii and also working with telecom giants such as O2. So what I'm now going to do after that short intro is invite the panelists just to give a 1-minute overview of their perspective in this area and what interests and excites them. Vic, if I can come to you first on that.
Thank you, Greg. Sorry, I'm hoping that I'm on screen now. So thanks, and I'm really delighted to be here. As you say, I'm the Chief Executive of the National Care Forum, and we're a membership organisation that focuses on works with not-for-profit care providers across the country. So digital is a massive part of our work and the opportunities it brings to those who are receiving care and support, and indeed the very rich data that it provides us in order to better understand how to develop care for the future. But I guess in the context of this discussion, you asked me about what interests and excites me. There's a number of areas that I want to mention in my brief minute. The first of those is obviously around data. Now, I'm really interested to hear from the context of home care at home monitoring in a sense, but I know some recent work that we've been doing talking about residential settings. There are, in any year for any one individual in residential care, there are 18,250 data points for that one person. So thinking about the potential for that data to be really brought alive and to drive forward not only the care that people receive, but to help identify preventative interventions and strategies that will support people to remain as independent as possible. Really excited about that. The second bit is about the opportunities that brings for kind of efficiency and stratification of risk assessments and other approaches, and therefore ensuring that the right level of care and support is brought to people when they need it most, and resources aren't, scarce resources, both in terms of people and money, aren't wasted. And the third point, and I'm really, really keen to hear colleagues' perceptions around this, but I think this approach to work offers real opportunities for us to galvanise and excite people about social care, working in social care. So what does this mean for the roles of those delivering social care now and in the future? And how does some of that, how can we work together to sort of vision what some of those new workforce requirements will be, both in terms of understanding and utilising data, but also in terms of utilising the tech and having the right skill sets within the workforce to enable that to happen in practice.
Fabulous. Thanks, Vic. Great start. And over to Ahmed.
Hi, Greg. Hopefully I'm on screen. Yes, I am. Thank you very much for the invite. Very, very pleased to be here. Really looking forward to a fantastic discussion. Yes, in terms of background, Cradle's been around since 2016. We've been building the system from around 2018, and we're happy to say that we're in market now. It's the only TV-based system that addresses social connectivity and also addresses wellness and health through an IoT platform. The reason that we've built that is we're taking a very user-centered approach. We see aging and the attitudes towards aging that need to be changed. And so one of the things that, in answer to your question about what's going to happen in the future, I think that what we're interested in enabling is a much more positive approach to aging by addressing factors such as resilience, independence, and really trying to address isolation and social isolation, especially amongst the older adult population. I think what Vic pointed out in terms of where I think digitalization is really helping is using the data to do two things. One is to enhance connectivity amongst people. So we've got family, friends, we've got the user themselves, and then we also have service providers who all need to consume that data. But then we've also got ways of consuming the data to help support people's independence and to improve the way in which they are living their lives. So I'm really looking forward to hearing everybody's thoughts on that.
Great, thanks, Ahmed. And over to Mario.
Lovely, thanks very much. Nice to speak to everyone. So what is it that got me into this and got me excited? I had a lovely life living in Australia, where I was organising lots of different events, large corporate events. Came back to the UK for my family. And in about 2008, having worked at a number of large IT and telecoms companies, my mother, who is a carer, advised me that my auntie, her sister, who is now 90, was in need of some help and some care support. I then, in 2000 and probably 8-9, went to visit my auntie, and I saw what was given to her. And I guess I was a bit sad, disappointed, and shocked, if I'm honest. So she was provided with technology that basically said, stay inside the house, don't go outside. And I was a little bit disappointed, having come from a technology, a mobile background. And knowing my auntie, who's an ex-major in the military, was always up and about, walking outside, and her words to me were, I don't want it when I'm indoors, I want it when I go outside. That's when I feel vulnerable, that's when I feel like I need a little bit of peace of mind. So that's kind of what got me into Oyster. And I can tell you all about it, but that's what got me into Oyster. And the journey began in 2008, 2009, where we began our first managed service. So that's me.
Fabulous. Thanks, Marianne. Thanks all of you for those opening comments. Now, I want to open up the discussion now, and I suppose just to pose some rhetorical questions to get us going. And if we think about the future of monitoring, because this discussion, I think we probably need to just look at the current position and then look forward as well to the future. But in terms of the future and an overview, for me, it's, what does it look like? What technologies are there for us to build on? And I think there's a sense for me at the moment that we have this sort of steady data stream telling us perhaps that nothing's wrong, nothing is actually wrong with the data that's coming through. All is okay. But how can we move from that position to a situation where we have technology that has improved to the extent that we can be much more proactive, providing better quality of life and transformation, and actually predict things that are due to happen. Now, I'm not suggesting none of that's happening, of course, but I think that sort of sets the scene for me, and the pandemic as well as a potential catalyst. So, in that sense, starting with the current, I'm interested in what each of you actually sees as the purpose of monitoring in the first place, and I'll come to our Mayor first on that one.
So the purpose of monitoring, the way that we see it is that we have these three stakeholders. We have the user themselves. We call the older adult the user. We have the family and friends, the people who care for them, and we also have service providers. Now, monitoring has some negative connotations associated with it, but the way we see it is peace of mind. So for the older adult, there's peace of mind that there is support available if something bad should happen. For the service provider, they're able to see in much more real time, in a way that's much more convenient for both parties as to what's happening. And for family and friends, it's okay. So mum or dad live remotely from me, but I still know that they're okay. I know that they've gotten up or their day has started. And so I think it's that delivery of oversight, peace of mind to those three different stakeholders that I think monitoring is really important.
Thanks, Umar. And Mario?
It's a difficult question, actually, I think. So I think monitoring today is not where we need to be. And I think there are huge gaps in what we do today, what's traditional monitoring. I think the future is going to be very bright. I think that we need to definitely, as Amir was saying, include what we call the care circle. We need to be sharing that information, certain information, with different groups. That could be the family, that could be the social care team, that could be the occupational therapists, and so on and so on. And I think it's how you bring in the data in a secure and safe way that you can start to look at that data, analyze that data, and then start to present, insights and outcomes. What I'm not convinced by at the moment, and I'm sure there'll be lots of people listening in that may well shoot me down, I'm not convinced by AI at this moment in time. We're a big one in believing in take the A out of the AI and provide the information to the intelligent people. And those intelligent people, we believe, are the frontline staff, the family members, the doctors. Those are the people that spend time with those vulnerable people every day. Those are the people that need the information presented in the right way to help them understand insights and outcomes to improve, people's lives. So that's really where we're coming from. And it's how we get all that data in. But incredibly important is how you look after the data, ensure it's secure, and ensure it's what people need. And that's working with the doctors, the social workers, occupational therapists, because those are the right people to help us to deliver those correct insights and outcomes.
Thanks, Mario. And I'm sure we'll touch on the ethical aspects of all of this either sooner or rather than later. Vic, I'll come to you next before I bring in some other questions.
Yeah, sure. So, I mean, it's interesting, isn't it? As as colleagues were speaking, I was thinking, well, yes, peace of mind, and all of those things are kind of key to it. But the term itself is pretty unfortunate, isn't it? Because I think we've. So I suppose I think about in the context of quite simple technology. We've had, certainly in the housing world, we've had a lot of that kind of tech-enabled care via warden call schemes and those sort of things, which I would see absolutely in the peace of mind enabling type category. I think the difficulty is we're moving forward and monitoring has unfortunate connotations, and feels very passive to the person, about the person who's at the heart of it, really. And I think it throws up, you talked about the ethical questions, and I think that we've got to get the balance right, that we are sure and confident that it does provide as much for the person whose data it is as it does for the others around them. So I think if that is the sort of triangle of people who need to know, so relatives and friends, the person who's receiving care and support, and the provider, I suspect the balance at the moment in terms of how technology is being developed and promoted is much more towards the service provider, some to the relatives and families, but little that is necessarily changing the way that the person receiving care and support experiences things. And I think it's about how the ethical bit is about whose data is it, and can we prove the relationship between the better source of data to the provider? And I think there is an absolute relationship there with that, and the direct improvement to the person receiving the care and support. Yeah. And can we also make sure that they are a recipient of that data, their own data, in a way that is that gives them back greater control.
Thanks, Vic.
Yes, sorry, can I just comment on something that Vic just said? So one of the things I think that's absolutely spot on. The data is just numbers until you can do something with it. And you think that the service provider is the person who's going to do something with it, or the family is going to do something with it. Actually, it's as you point out, the way that we're approaching this is that the data is owned by the user themselves. And for them to share that data, there needs to be a reason. There needs to be a quid pro quo for them to do this. And the way that we think about it is that it's got to provide some kind of actionable insight to them. I mean, essentially, people just have two questions that they want answered. How normal am I, and what's going to happen next? And if the data can be digested, can be processed in a way that delivers answers to those questions, you can start to really see people engaging with some of this information and insight that starts to come from monitoring. And actually, you can start seeing them want the outcomes from it. Sorry, back to you, Greg.
No, absolutely, and I'm all up for discussion rather than just Q&A. And thank you both. I mean, I think if we think of what you've just been talking through there, and consider the thought about surveillance in this respect, and unpack that in terms of the way people are changing. Those people now, in 50 years, will have grown up with the internet. Will maybe look at things very differently to what some of us do now. Do you think people might look differently at these sorts of questions we're asking now when they're in the future, based on what we're discussing currently?
I mean, just an immediate thought is yes. I mean, I think people will see, data will have a currency that we haven't yet kind of articulated properly. We're still in the very early stages of giving away much more of our own data than trying to think about how we capitalize on that ourselves. I'm as right in that sense that what we've got to be able to do is to make that help people to understand their own situation and what they can do themselves to do that. And I think that's where the preventative stuff is very exciting. So, you know, and we're seeing that, aren't we, in the context not just of people who receive care and support, but in the general population, and a sense that a lot of the focus on health apps and wearables and all of this is around prevention, and sometimes that's articulated in a way that gives you a financial reward associated with it, you know, linking it to insurance schemes or that sort of side of things. So if you think about where social care might go in the future, in the sense of, you know, maybe there being voluntary or national insurance schemes that link to funding associated with social care, you can begin to see that you can sort of track a passage of people's lives. I mean, it's quite, it's one of your science fiction stories, Greg, I suspect, isn't it? It's that sort of, you know, how did the decision you took when you were 25 and the data that's flowed from that affect your ability to access social care in the future? And if we can unlock some of those answers, there will be, you know, will give us some really interesting insight into the power of data. I think people will think of it quite differently, though, and I suspect as we move forward, it'll become more and more transactional. So,
thanks.
I agree with what Vic's saying there, and I think that Mario's point earlier about AI, right, where it's been a little disappointing. I think that's correct. You know, there's been so much hype, and the expectation is way up there, but the delivery is poor. But people have an expectation now, you know, that their data will be analyzed and they'll get something for it, right? You accept cookies on your phone so that you can get the right kind of advertising and you can see things that you're interested in. You're okay about sharing that data. And I think that that's exactly what will happen with monitoring, surveillance, oversight, peace of mind. What do we do with the numbers? How do we get value? How do each of those three groups of stakeholders get value? How can they solve their problem? I think AI will help when it gets better. But yeah, 50 years in the future, no one's going to care.
It sounds like there's something about messaging as well here. You know, generally across the health and care system, the importance of messaging and helping people understand, as you just described, things that they're already doing. Why would they not be doing them necessarily in this context? Right. Question. Mario, did you have any comments you wanted to bring in at that point?
Not really. I mean, I think, in 50 years' time, who knows where we're all going to be in the world we're living in today. One thing is for sure that, so I speak to, we call them VIPs. So we speak to vulnerable people. I speak to them every day. This morning I was talking to a lady who has a certain illness. She disassociates, and I will phone her probably 3 times a week because I like to understand how she is and get feedback from her. You know, how are things, and it's a mixture of things, are helping her or not helping her. So I get a lot of insights, I guess, because I spend a lot of time speaking to people that use the service as well as the families and the social workers. I don't know if it, so I keep hearing from lots of people as well about, you're just going to give them a smartphone or you're just going to give them this smart tech. And I'm not so sure on all of this because, as I said, my mother's still a carer. She's 73 this week. And before she became a carer, she was the corporate head of customer services for Vodafone, believe it or not. So she understood mobile phones. She struggles at 73 to understand her digital devices. She struggles with her television, her mobile phone. So one thing that I think is, it's very difficult because it's easy for us now at our age, when we're still just about with it, to say this is what's going to happen. But I see such a change in people. Not everybody, but I do see such change. So I think it has to, whatever it is, whatever we're doing, we have to make sure it's easy and simple for vulnerable people to use, but you're getting the right information to present to the right audiences. That's all about, I think, is just making people live their lives far better, far less isolated, and all that great stuff, with insights and bringing down the care costs at the end of the day. So yeah.
Great, thanks, Murray. I'd just like to build on that because there's a question that's come through from Jerry Turner from Cure Care. I hope I pronounced that correctly. And he says, service users have varying abilities and attitudes towards tech. However, we as an audience may see ourselves as self-managing. So how much should self-managing be a part of envisaging future development and use of tech? Does self-managing alter the strategy around tech? Any thoughts on that? Big?
You go, Alma. That's fine.
Yeah, absolutely. I think there's a degree of sophistication that comes into into the way that that we're going to be dealing with people, but particularly older adults as a segment. Right now, there's everybody's just in plus 65. That's it. It's just one segment. But as the question points out, there are different types. There's self-managing. There's people who require more management. There'll be more sophistication that comes into it, and we'll see different levels of support that's being required, which may be automated, but which may also be delivered by face-to-face interactions as well. So yeah, I think things are going to change as we get more and more older people, and their needs are more and more varied.
Thanks, and Vic.
Yeah, I mean, I think Mario's description of trying to use the tech was a very familiar story, having tried to share the joys of touch screens and mobiles with my mum. But where's it gone? Where's the picture gone? All of that sort of stuff. And we've got to get smarter about all of that, because there's a whole host of people who could self-manage much more effectively, particularly using voice as part of that control mechanism. And I think the smarter systems are recognizing and using some of that. And I certainly have seen some excellent kind of assistive tech, particularly used in learning disability schemes and older people services, where people can control their environment through that tech in a way that does mean that they've got an awful lot more control of the space around them and can make decisions about who comes in and who doesn't come in, and windows open, shut, and all that stuff that without the tech, it means that people have to take a much more passive role in their own life. So yes, our ambition should be to get the tech to the point where it enables people who can to manage as much as they can, and then the focus will really be on supporting those who don't necessarily maybe have capacity or really don't find a way to be able to engage with it, to get the right support to them, and then to use the skills and experience of that workforce to work with them to understand, if there are things that maybe are not done by the individual themselves, but are done through an understanding with the workforce of what they would want. But yeah, I mean, I don't think we're anywhere near understanding what proper self-management, we haven't got the market right, have we? I mean, that's always the challenge for social care, particularly, is because we're such a fragmented marketplace. I mean, it's a complete nightmare for suppliers. I really feel your pain, in terms of, if you're trying to bring a product to market, you've got to bring it to kind of 20,000 different organizations who all think they know what they want in very specific, and the people they work with are very different to everyone else. Well, they are, but they put together, they make up a whopping great market that actually, if we can get the people who develop the tech to at base to really be thinking about self-management of people who find smart screen is very difficult, or who find articulating specific words difficult, but actually can make sounds or recognizable rhythms or patterns, and that can then be used to self-manage, then it's a real game changer for people. Yeah,
thanks, Vic. Mary, I'm going to come to you, because I'm thinking, building on what they've just been saying there, if we reflect on sort of comparing and contrasting different monitoring tech, we've been talking about this already, and perhaps users' perceptions of the tech. And I'm just thinking about what you said about your aunt, and she wants the tech when she goes outside. That's what she said to you. Can I just unpick that a little bit more with you in terms of your work and what you're doing?
Yeah, I'm pick away. So she was an active lady, okay, as I said, and I saw lots of active people in her circle, I guess. And she lives alone. She's always been single. She lives alone down in Devon, okay. When I saw that the services, I guess, that were being provided then in most of social care, you know, most vulnerable people's homes, or was at, you know, if you need help, press this button. But, you know, do not leave these four walls. Do not go outside. And should you go outside, you're on your own. And I was so, I'd never seen this sort of thing before, because I was, as I said, I was in the events industry and various other, so it was a whole, it was an eye-opener for me, because I couldn't understand why anyone would want to be stuck inside, okay? And why anybody, any organization would want to provide something that just sits in the house. It didn't make sense. I know it's where we came from, but I also know that was 50 years ago, you know? The rocket went to the moon and they created the button and box. I say button and box, I know it's much more, but that's what they did. And here we are in, I don't know how many years later since the rocket went up, and it's been a real struggle, I think. I think as you both said, about trying to show social care teams, organisations, monitoring companies that there is a different way. It's been a real. I'd say there's been a real pushback. Actually, people don't want to change. You know, they want to keep providing the service they provide. And personally, I think it's not good enough. You know, but that's me. I'm a simple guy. I just don't think it's good enough. Hence why, coming from that mobile background, I sat there going, there must be something more that we can all do. There must be something more. And that's when I started to understand a lot more, you know. I think that there's lots of different groups, lots of different VIPs, all different ages. So when I say VIPs, I'm not talking about my old auntie there. We work with lots of learning disabilities, children and adults of all types. They're all going to want different things, you know. They're not going to want certain products or services. There's a mix of things that they need or they would like. What I think is, how do we bring those different bits of tech together? I think it's how we use all of that data that's coming in, not only so that that VIP can feel confident they can go outside or be in the house, upstairs, downstairs, you know, but it's how we bring that together, providing, you know, you talk about the self-monitoring, so it should be able to allow certain groups to self-monitor, but those groups are able to, and they can get the information that they need. I'm a massive one. We're working with lots of OTs at the moment, OT organisations across the country, because they need help. The occupational therapists and the TAs and this, so they need help, and they're not getting help. Yeah, they're busy, they're stressed, and so our whole focus is, how do we bring all that tech together in a simple system that all the different groups can get the right information that they need. But what I'm so keen on as well is what I brought up about AI and all these things. Who knows where the future is? But what I'm worried about is people are starting to lose sight of personal care or personal support. And I think if organizations like ours, like mine, can work with those organizations, we work with lots of different companies to bring tech in. You know, no one company can do all. You've got lots of monitoring, as in people that answer the alarms. Lots of those companies out there, they're all trying to become maybe more than anything, you know, but they are monitoring companies probably. That data should be flowing into those. But what we should be doing is providing as much information in the right way and service and support to look after and support all the different teams, including, as I say, the OTs, who I know are struggling significantly. And I think it's, you know, I don't want to talk about words like interoperable, because there's lots of tech, you know, trendy words at the moment everyone's talking about. What I'm trying to say is, whatever it is, you bring it all together in the right way, secure and safe way, providing it to different groups in different formats, but making sure there's that personal support. So our teams have to support those individuals, because when I talk about, as in those organizations, because everybody's become a tech expert now. I think everyone's a tech expert, and I don't think Yeah, and good on them. But I think what we forget about is sometimes people see bright, shiny things and it looks nice, but they completely forget about, as I said to you before, about what that product is, how secure is that product, is this happening, is that happening? And that's my whole thing, is you've got to look at the whole end to end of those things.
So some good points there around, well, lots of good points, specifically around galvanizing the workforce, perhaps, and going back to what Vic said earlier on. I mean, Vic, when you hear that from Mario, does that give you a warm feeling about where we're headed with the kind of work that he's doing, or what else can we do?
Well, I think it's a really interesting. Yes, of course, Mario. Thank you for giving me some encouragement. But I think it's we've got a real challenge around workforce, haven't we, in social care generally. So we know that we've got a very high level of vacancies, and just talking with members today, we've got massive growing challenges around recruitment and retention within the sector. And so I think that, the good bits are where, so let's think about, in the context of this conversation, let's think about how greater use of these systems and enabling more preventative and more effective working through that, how that will encourage people to join rather than replace roles, which I know is always people's fear in this context. And I think it will. The fascinating bit for me, and let's have a bit of politics in this, so that the workforce is 82% female workforce. It's an older workforce generally. And it's not a very digitally enabled workforce. So one of the things that I think we've got to think really carefully about this is there's a lot of potentially interesting new roles, data roles, technologist roles, and these things which will bring people in, which is great news. But at the same time, we must think about how we invest in supporting that existing workforce to be able to do this. What we don't need to do is to create an environment that excludes the very people who till now have been providing fantastic care and support under extremely difficult circumstances. So we've got to think about not just upskilling the tech in this context, but upskilling the workforce. So those people, and again, this particularly female workforce who don't have digital as part of their core set of skills, are then enabled to deliver the care and support that's needed in this new environment. And I think if we don't do that, we make it out. I'm interested in the new and the shiny, in a sense. We're all interested in the new and shiny, but whilst we need a new and shiny workforce at some level, we also need to make sure we invest properly in getting those skills up to speed.
Thanks, Vic. And Arne, I'm sorry, questions are coming in, so I'm just going to try and feed these in as we go through the discussion. But Arne, thinking about what Vic's just said around workforce, you talked earlier about aging and attitudes are changing. So sort of maybe stepping back from the workforce a bit and around the positive approach that is needed for the future, both in terms of these sort of good signs that are being played back to us by Mario around workforce and Vic's analysis of that. What's your view around how we can move forward positively?
So I think that both what Vic and Mario were saying is correct in terms of the technology. It's part of the reason that people don't adapt smart screen technology is it's not designed for everybody. You end up with poor circulation of the tips of your fingers. You can't activate apps and you can't do that. But then there's all this technology that's coming in and new innovations. And part of the reason that I think there's still so much more promise to fulfill is that these innovations require people to do new things. And any innovation that requires a step change in behavior is a poorly adopted innovation. It just takes much, much longer for people to make those changes, as Mario is saying. What we're trying to do is we're trying to use existing technology. So any TV, doesn't have to be a smart TV, and it's the most widely used TV. It's the most widely used technology in anyone's home, right? Everyone has no one has a smartphone room and no one has a tablet room. They all have TV rooms. So we're trying to use the TV. We're trying to use the configuration of the room that's around the TV to make that the way in which people can embrace new ways of working. So efficiencies, perhaps people can start, once they engage with the system and they're used to making video calls through their TV. It's, we have a very simple system that's just designed with yes, no. So you can start seeing what we envisage as the future is care, certain ways in which care is currently delivered face to face. Some of that can be virtualized. The loneliness is becoming it has really gained so much prominence in society that care visits are less. Befriending is something that's becoming a service that people can start offering to address loneliness. Some of the trusts that we work with, some of the councils that we work with, they see loneliness as a major problem that they need to address, and they use our video calling capability to do that. So we think that virtualizing certain elements of care, and then coming back to your monitoring question, if you start to bring data from physical movement monitors around the home or Fitbits, room temperature, all this kind of, you start to bring this data together, put it in front of someone, then they've got something to talk about when they call in. So I think Vic and Mario are both right. People are going to have to adapt and change. But as long as we make those changes incremental, very small, then I think we'll start to see the big step changes happening over time. Virtualization is what I think the social care sector needs more of, because it's stuck in this way of just delivering care face to face. And I think everybody who's joined this call today must be thinking, well, how can we get more technology adopted, and how can we get the benefits of that more widely spread?
So this is fascinating. It sounds to me as if I'm hearing you right, that alongside the amazing things that are going on now that will transpire as new products and services in the future, and things we can't even imagine now that we'll find being used in the care system later on. There's technology around now that we've had for years and years that we can just use in different ways and actually help the workforce deliver better independent outcomes in terms of independent living for people in their homes, etc. So this isn't just about an amazing new gadget for the future. Right. Yeah. Okay.
Absolutely. It's building on what we've currently got. It's using the way of mass communication, disseminating interesting content, bringing more people into educational programs where they can start to share interests with people and create new contacts. These kinds of things that exist that we should be able to get more broadly spread.
Thanks, Amit. I'm just looking at the questions here because I'd like to bring some of these in as best I can. There's quite a long question here from Kevin Doughty from the University of Cumbria, and I just can't read it all out, but he says all the speakers seem to be suggesting that the issue is how to offer the right tech for individual people rather than offering everyone the same button and box or the next generation of voice buttons and Alexa-shaped boxes. Surely the problem is one of assessment. Any thoughts and comments on that?
Yeah, I think that's a really good point. And assessment for people's needs is also becoming more sophisticated. We've got, as I said earlier in my intro, one of the things we're desperate to address properly is resilience. And that requires, as Kevin's saying, a proper assessment, understand all the different components, and then apply the interventions. So yeah, good point. Assessment is absolutely the way to go.
Thanks on that. And Vic, sorry, do you want to come in there?
Well, no, I think it's back to again banging on about this the skills question, because I think assessment is part of it, and staff are very, very experienced at doing assessment, and that's what that's what person-centered care is. What you've then got to be able to do is to understand what the digital possible solutions are, and I think that's where the gap currently is. It's very interesting. On Thursday, I see there's another question about kind of, the evaluation and monitoring of systems in social care. So on Thursday, for the first time, a direct purchasing system was launched for care planning software. Now, there's been care planning software around for probably 15, 20 years in some shape or form in social care. But this is the first time that there's a kind of properly, assessed purchasing system which outlines exactly, future-proofs the care planning software that people engage in against a sort of properly established vision of what what we need care planning to look like in the future. Now, the challenge for organisations, particularly if you're thinking about them being then able to invest in the tech that then might meet people's needs, is without that clearly laid out and articulated pathway of what we want that tech to do and what we, you know, is the purchasing decisions around that, and how you make that suitably flexible to enable. You're absolutely right, Kevin, you know, that people need to have the bit of support that will help them, not just, you know, X system, but we need to firstly have in place a kind of a digital infrastructure for social care that just doesn't currently exist. We've got NHSX, we've got NHSD, but the level of attention that's been applied to social care and the sort of systems that are available mean that, you know, not only is it a nightmare to be a supplier in this market, but it's also quite a nightmare to be a provider, because you don't know whether what you invest in will be fit for the purpose in 2 years' time, never mind in 10 years' time. So I think, so it doesn't, you know, absolutely, we need to assess people. We need to find a solution that fits them and their personal needs, because that's the only way to deliver great care. Yeah. But we've also got to get people to a place where they are equipped enough and know enough to make those decisions, and the systems that are on offer articulated in a way that means they're confident to do that, and that they've gone through a sufficiently robust planning, a sufficiently robust kind of evaluatory system without stifling innovation alongside that, because that's the other bit, isn't it? What we don't need to do is to kill innovation in the process.
Yeah. Well, on that point, Mary, I'm going to come to you in a second. I just wanted to reference, I was looking at some of the trials that have been going on, perhaps pre-COVID, but also definitely during COVID, and some of the work that's been going on around sort of home monitoring in relation to oximetry and oxygen saturation, some NHSX funded work through various locations in the country, you know, optimizing triage, monitoring warfarin doses from home. There's obviously, you know, there's a lot of work going on around trials and projects and programs to try and move forward the thinking, which is great to see. But just on the point Vic made at the end of your piece there's a question that's come in from Carol Fogg around, okay, she's from a medical device background, but she wonders if there are specific guidelines for the development and approval for tech used in social care, or a requirement for evaluation once launched. And Mario, from your perspective of how you found, you know, as an entrepreneur, developing your business, implementing solutions, how have you found, you know, aspects of what you've needed to go through to do that?
It's very difficult, if I'm honest. We found it quite hard to find the right paths to go down. It's been a lot of hard work, banging on doors and trial and error. Over the years, thankfully, we've built up a great relationship up with a number of social care teams, local authorities, you know, some of our close partners like NRS and PA Consulting, who are out there every day delivering these services. So we've been able to, I guess, learn a lot from them and develop things that they're saying are real beneficial. But it's not clear in regards to the, you know, trialing and testing these type of bits of kit, whatever it might be. I think we go above and beyond most. You know, we go all the way back to the factories and check supply chains and have all these devices independently tested for safety, security, that type of service, which I'm not sure how many other people are doing, which is why I say it, not because we're doing it, because I don't want to give my mum, who's, as I said, 73 something in a few years' time, and I find out that it's not been as secure as we would like, or we've not looked at that whole supply chain. So it's not easy and it's quite expensive to do, but I think it's, yeah. So I haven't come into the business as a quick buck, yeah. I've come here to try and change the way we help to deliver various services in social care. I thought it was interesting what Kevin was saying on your assessment, and I agree with everybody there. And that's been particularly hard to try and work with people doing assessments, because they know what they're doing, yeah. But we have started in the last year or so being helped to work with those organisations. Some of them are doing the assessments to start to help change maybe what's within the assessment to allow it to be much more for a different type of user, or to look at different types of tech. But as Vic said, they're not specialists, and why should they be? That's not their job. Their job is to assess and take care of people. It's our job, I believe, to help give the knowledge and the information in the best way to those people, because they can make the right decisions. So, yeah.
Thanks, Mario. And I mean, I'll bring you in, because if we build on those, or Mario's experience of maybe some sort of barriers to entry and how he's gone about tackling some of these issues, to what extent do you think COVID and the pandemic will prove to be a great catalyst for breaking down some of these blocks? Do you think it will? Thinking about the future.
It has been. I think it's done it already. Our experience, so we're working with social care and we're working in healthcare with the NHS. And you know, the stats have become pretty cliched now, right? There's 70% of face-to-face, what used to be face-to-face for the NHS has now gone virtual because of COVID, and it's never going to go back. Why would it, right? It's so much more efficient and effective to do it this way. And when people need to have the face-to-face, they can go and do it. But the requirement is still to. And your use of the word catalyst, this is exactly how we saw the pandemic right at the beginning. It's been a catalyst for adoption of virtual interaction, which a lot of people thought was impossible. You couldn't do in this area and things just would stop. That's proven to be untrue. I think what we've shown is that there is a place for virtual interaction, just like there is a place for physical interaction, and adoption of both will depend upon the needs of the user. So as long as we're focusing on what the person, what the older adult actually needs to either solve problems, to actualize their life, to meet their aspirations, as long as we can focus on those, then the right mix is now available. They can choose to hopefully they can choose to be virtual or choose face-to-face. I think the pandemic has been a real cause of change. And you know, we're doing the point you mentioned about oximeters. We're doing remote monitoring of blood oxygen using the platform and TV consultations. I think it's fantastic. It's the way of the future.
And do any of you see exponential improvement as a result of the situation we've gone through in the last year? I mean, it's clearly a catalyst, as we've said, but is that going to propel us into something way beyond where we thought would have been possible?
Yeah, I mean, I would say this, absolutely. I think we're just at the very, very early stage of a hockey stick curve on what's going to be possible. Having so much data swirling around, so much connectivity swirling around, it's just a matter of time before something really quite fundamental changes the way in which health and social care work. You're on mute, Craig.
Sorry, there's always one. Mario,
well, that's the other thing
that
the pandemic has done. It's made that's the other thing that it's made that phrase ubiquitous.
I think
sorry, Mario.
No, because I think you're right. I think there's going to be a blend, yeah. And I think, so I agree with that. I agree with Vic at the very start. She said about seeing and hearing. I think I remember her saying, and we've always said, you know, the important thing is people can see and hear for whatever the reasons are. And I think that's going to be a blend. And I hope is what one of our hopes here is, with bringing in all this new technology and all this new stuff to drive all these outcomes, these insights, maybe allow things to free up to help support those individuals more, and through just phoning people, even, or talking to them through their systems. It's, as I said, I'm a busy guy, but I have a number of people I phone every week, and we have a 20-minute call. I have about 10 people I phone, specifically vulnerable people. From when I started the business, they still use our services. And and they look forward to our call. And in fact, I look forward to my call with them, because I learn quite a lot, and they tell me what's good about us and what's bad. They're very direct, you know. When you get to a certain stage, you're quite straightforward. So yeah, a real blend. But I'm just hoping that we all remember there's nothing better than well, this is me, than a good old chin wag, you know. It's just been all a bit better.
Thanks, Mario. Vic, I actually have another question for you, sort of leading on from that, because it links to Neil Smith's question that's come in. If we're talking about exponential improvement, exponential growth in this area, but actually we've still got some maybe rudimentary issues with the way that folk are skilled up to use the tech, be they professional carers or unpaid carers, family, etc. How do we deal with that?
Well, I was, yeah, I mean, I'll give this, I'm very aware of the potential. I'm also very aware of the squashing ability of our of the system around that. So I think, so there's two things I'd mention. One is that we haven't talked about the role of commissioning in all of this, and you know, large proportions of social care are delivered through the public purse and through the the direction of commissioning teams, who generally I think are in a similar place to lots of providers themselves, and not very digitally aware, not very kind of skilled in terms of that context. Not all, of course, and apologies commissioners out there, but you know, we're all trying to learn in that environment. So that's one side of it. And I think, you know, and I think it is a government responsibility to enhance the way that digital's used in social care, in the same way as it has done in health, and invested billions and billions and billions of pounds into the health system. It needs to be doing the same thing around social care. And so and my worry is that we've got a government that I don't think can quite decide between carrot and stick. And the carrots that I've seen are very, 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 very small. And the sticks that are out there, which is generally the regulatory regime, are very big and undecided and unclear about exactly what they're going to be looking for and when they're going to need to see it. And I think we run the risk of the exponential curve being a kind of, you know, being flatlined before it kind of even starts, in a way, because we'll pick something that we need to move towards, which at the moment in government stated activity will be care planning, and then we'll basically say, well, we've got you to there, we've helped you stagger to that bit of the line, perhaps with some help or perhaps not, and then you're on your own. And I think to serve people best and to serve communities best, we need to look at the type of investment plan that we've seen transform large chunks of health. I mean, you know, how have we got to oximeters? It's not because individual hospitals around the country decided it would be a great idea, or individual CCGs. It was because there was an understanding of what anticipatory care could deliver to support people and save health service money. And we need that vision in care.
Well, you know, this hour has gone so quickly. We've only got a couple of minutes left. I feel like we could talk for another hour. I'm going to ask you for maybe your quick 30 seconds key takeaway from today in a second. I suppose if I could just say from my own perspective, Peter Gerber's come in with a point. How can we change the fact that virtual rather than face-to-face appointments are mainly on the phone and not actually virtual, he says. It is interesting because when people phone me up now and then these days, they message me first to say they're going to be communicating old school. So, you know, I suppose, you know, what is the new way of doing things? And are we still actually doing or using old methods, but thinking that is new because it's not face-to-face, it's actually on the phone? So maybe that's something for me to reflect on. But Amer, quick takeaway from you from today? Very brief.
Yeah, no, look, first of all, it's been a fantastic discussion. Thank you very much for the input. It's been, I think the thing around virtual, this last point that you made, how does virtual become more ubiquitous? By using familiar technology, like the TV, I would say that though. But data is going to be the key piece. It's interaction, it's feedback loops, and I think that's what I've understood here. That you know, this point about monitoring is going to drive a huge amount of interactivity.
Thanks, Emma. Mario?
Well, I guess I'm obviously going to say it's making sure we don't forget the various different people we're interacting with, yeah, and people that need the support and the help, as I talked about, whether it be the VIP or the OT or the social worker. We're there to, we've got to help them, and we've got to educate, I think as Vic said, the commissioners, because they need help. And I'm a real simple guy, and I just keep saying, as I said before, I talk about my mum and my auntie because I'm meant to, because they tell me I have to. But we've all got people in our families or that we know that are vulnerable or need a little bit of help. And I think that maybe we all might need, some of us, some help. And let's not forget that, because we want to leave the place, I think, as people were saying, the social care, we want to leave it in a better place if we can. And it's difficult, but together I'm pretty sure we can do it. It just needs that will. And as you say, a bit more of a carrot, less of a stick, maybe.
Great, thanks, Mario. A final word from you, Vic?
Well, I mean, I agree. It's all about people. It's people, it's vision, it's ambition, and you know, ultimately that will be the test. If people at the end feel more enabled and more supported, and that's all we should really care about. Great.
Look, thank you all. Thank the three of you for a wonderful discussion. Feels like we should have another one soon in one of these events or elsewhere. And thanks everyone for joining us today as well. The questions have been brilliant. I think I've been able to bring all of those really into the discussion. Just as we finish off, we're about a minute over, but I've got a couple of things just to mention. This is part of a series. It's the second of 4 events, as I've mentioned, around our work at Future Care Capital on health and care and technology. We do actually have another event on the 30th of June, which is in relation to our fictions sci-fi series that Vic mentioned earlier. That's been a very successful, very interesting series that we've done, a new sci-fi story on a health and care issue every month from a different perspective with different authors. And we're bringing some of those authors together with Future Care Capital colleagues at 4 p.m. on Wednesday, the 30th of June. If you're interested in that event, please do sign up via the link on our website, and we'll be exploring some of those fiction projects. But just leaves me to say thanks ever so much to all of you, and I'm going to close the event there. Thank you.